evening, everyone. My name is Ann Lewak, and I'm the Vice President of Education at the Hemophilia Federation of America. And on behalf of HFA, I'm pleased to welcome you to Gratitude Works, How Gratitude Heals, Energizes, and Transforms Lives. Our speaker this evening is Dr. Robert Emmons. Dr. Emmons' presentation is brought to you by the HFA Mental Health and Wellness Initiative, through which HFA is committed to providing mental health education and resources for the bleeding disorder community. Before Dr. Emmons begins, some business. All attendees currently are in listen-only mode. So if you have questions throughout the webinar, please type them in the chat box, and we will allow time at the end for Dr. Emmons to address them. We are recording this webinar, and the recording will be available on the HFA YouTube channel later this week. Now, for our speaker. Dr. Robert Emmons, PhD, is a professor of psychology at the University of California, Davis, where he has taught since 1988. Dr. Emmons received his PhD from the University of Illinois at Urbana-Champaign, and he's the author of over 250 original publications in peer-reviewed journals or chapters in 8 edited books. His research is focused on the psychology of gratitude and joy as they relate to human flourishing and well-being. He's been a frequent speaker at professional conferences and public events. He's guest lectured at Yale, Oxford, Stanford, and the University of Michigan. His groundbreaking work on gratitude has been featured in dozens of popular media outlets, including the New York Times, USA Today, US News and World Report, Newsweek, Time, and NPR. He lives with his wife of 25 years, Yvonne, and their 2 sons and 2 dogs in Davis, California. Please join me in welcoming Dr. Robert Emmons.
Thank you, Ann, very much. And good evening, everyone. I guess it's evening where most of you are. And I've been looking forward to this for a while now, since I got the initial invitation. It really is an honor and a privilege to be able to speak to you and to share with you what I'm passionate about. I've been excited about this all day. This was like the longest day that I can remember, like 4 o'clock. It seemed like it was going to be forever until 4 o'clock got here. And it was really hard waiting around for 4 o'clock, but I'm glad it's here now. And I'm just so excited to talk about gratitude, because it's what I've been studying for now over 2 decades here at the University of California, Davis. And one of the things I like to do when I do these webinars via Zoom, or I don't see you, I'm here and you're wherever you are, is to find out where you are at. So if you could just type in the chat box, like where you're at, state or city, state, or wherever, and then I'll at least have an idea where you're at. And that would be great to get us rolling here. Go ahead and type it in. Denver, Maryland, Virginia. Well, you guys are all over the place. Annapolis, Colorado. We got the whole country represented. Very cool. Oklahoma. Let's see, who's farthest away from me? Well, I guess that would probably be Boston, right? And we got some more, Virginia, DC. All right, so we're spread out, which is really cool. So listen, I'm going to talk to you about the nature of gratitude, the science of gratitude, linking gratitude to things like happiness and resiliency and coping with stress. So I have different parts to the presentation. Basically what it's about is the science of gratitude and the practice of gratitude. So I like to talk about 2 things. Number 1, what gratitude is, and then really why it matters. I guess there's 3 things, and how to get more of it. How can we all practice gratitude, develop more skills of becoming grateful? Because it turns out it's a pretty important skill, and gratitude leads to a lot of benefits. And as I've spent a lot of time really trafficking in the arena of gratitude, I'm learning more and more about what gratitude is. There's so many layers and levels to it. And sometimes we think it's one thing, but the fact of the matter is it's actually many more things than just one. There's a lot of ways you can examine it, and there's many nuances and niceties and levels to it. And so I hope to give you a little glimpse of that here this evening. So thank you so much for spending part of your Wednesday evening with me here today. And without further ado, I'm going to jump right in. So being a professor, of course, I have to do a PowerPoint presentation. Us professors, we really can't think without PowerPoint. And so Here we go. If any of you are interested, by the way, I'll give my contact information at the end, and I'm happy to shoot you a copy of these slides in this presentation in case you want to go over it again or use it in a presentation of your own, or convince your spouse to become more grateful, or children, or whoever, boss, coworkers. You might find some of this information useful for that purpose. Hopefully you'll find it useful in general, but also good for those reasons as well. Okay, so I've entitled the talk, as you've seen by the name of the webinar, Gratitude Works, How Gratitude Heals, Energizes, and Changes Lives. So basically that sums up like 23 years of research now, more than 2 decades of research, what I've learned, what I found, what the science has shown. Most of my work throughout that time has been dedicated to testing this next assumption here, this point. I call it kind of like my talking point. So most of the time that I've spent on this since really the late 90s has been dedicated to declaring and demonstrated the following: that gratitude is the deepest touch point of human existence, the deepest touch point of human existence. Now, I don't know about you, but if I heard someone make that statement, I might have a couple of reactions. I might say, first of all, how can that be? How can gratitude be the deepest touch point of human existence? And maybe I would say something like, what does that even mean, to say something is the deep touch point of human existence? I mean, that statement might strike you as either terribly presumptuous and or not particularly scientific, because usually with science, we state things a little bit more tentatively, with a little bit more humility, and we say things that, like maybe gratitude matters, or that it somehow affects our health or happiness or well-being, but we make a testable proposition, otherwise known as a hypothesis, and go out there and collect data, do studies, and see if actually if it has any validity to it. Well, I can assure you that at least as outrageous things have been said, even more outrageous than that when it comes to gratitude, sayings, proverbs, maxims, quotes about gratitude down through the ages. For example, gratitude has been referred to as the greatest of the virtues, right? That's pretty impressive. The greatest of the virtues. How about this one? Gratitude is the secret to life, one person said. Someone else said that gratitude is the key that opens all doors. That's good. I like that one. Gratitude is the sign of noble souls. That's kind of nice. Here's another one. Gratitude is the most passionate, transformative force in the cosmos. I'm not sure exactly what that means, but it sounds pretty impressive. Now, that's just gratitude. If you consider the flip side of gratitude, which of course would be ingratitude, even more powerful sayings have been directed toward ingratitude as an accusation. So gratitude is a good thing, a nice thing as a virtue, but ingratitude is a powerful accusation, right? We denounce the ungrateful person and episodes of ingratitude when we see them. One person said, a philosopher said that gratitude is the essence of vileness. The essence of vileness, that's pretty bad, right? Shakespeare said that ingratitude is monstrous. He said that it was hideous. Another philosopher said that of all the crimes that humans are capable of committing, the most horrible and unnatural is ingratitude, right? Someone else recently referred to ingratitude as a malignancy of the soul. I mean, it's amazing, right? The strength of these comments on both for gratitude and then against ingratitude. Well, those are inspiring in many ways, in many senses. But as a scientist, as somebody who is, who traffics in the arena of empirical science, testing ideas, assumptions, hypotheses, collecting data, conducting statistical tests, and so on, I don't want to take all those at face value, right? It's one thing to say all those things. It's quite another to actually, demonstrate that or to test those to see if those have any, veracity and validity. So that's what I've been doing for the last, few years, actually now 20 years, which on the one hand sounds kind of impressive, 2 decades of study of one topic. On the other hand, it's almost embarrassing. It's like, you've spent 20 years in this one topic, which seems so simple, if not simplistic, superficial. I mean, isn't gratitude just being thankful, just saying thank you, being appreciative? I mean, what could there be to be, uncovered and studied in over 2 decades? Well, let me tell you, there's a lot. And just when it comes to connecting gratitude with some of the things that we want in life, like happiness, like well-being, like wholeness and fullness and wellness and resiliency, right? A sense of contentment, a sense of well-being, a sense of joy, and all of those things that we most want out of life, gratitude connects with all of those. And if we've learned one thing about gratitude, and parenthetically, we've learned a lot, but if we learned one thing about gratitude, is that there is no sustainable happiness, there's no sustainable joy, sustainable well-being, contentment, resiliency without gratitude. It really is the key that opens all doors. It really is essential to growing a center of calm, contentment, confidence, happiness, well-being. And so what I want to do in this next 45 minutes or so is just really, unpack with you and for you the nature of gratitude, so that by the time we're done, collectively, our understanding of gratitude will become bigger and broader and deeper in many ways, okay, and more accurate, because I've learned that we don't always have the most accurate knowledge when it comes to gratitude. We think it's one thing, but in fact, it's something else. So that's what I want to do. And again, if you have any questions, comments, whatever, during the presentation over the next about 35 minutes, feel free to put those in the chat, and we'll just open it up, as Ann mentioned, at the end for questions and discussion and comments, reflections, and all those sorts of things. Okay, fantastic. So what exactly is gratitude? And if you know anything about psychologists and scientists, we have a way of taking things which seem so straightforward and simple and making them very complex. And so if you expect me to do that, I won't disappoint you. I can give you this definition of gratitude, which I like to define in terms of 2 steps or 2 processes. I refer to these as 2 stages of information processing. So the first one is affirming the good. So when we are grateful, we have an approach, an affirmative approach to life. We say yes to life, right? We say that there are good things in my life. I see good things. I notice good things. I see the good. I look for the good. I notice the good. I receive the good. I take it in. And that's part of what is required when we feel gratitude. The feeling, the attitude, the emotion of gratitude and gratefulness requires, first of all, just noticing the good, just noticing there are good things. So it's an affirmation, or you could think of it as a celebration of the good. It's seeing the good and noticing it and living in that reality that there is the good. Now, it doesn't mean that there's no bad, or it doesn't mean that there is nothing but good. It's just choosing to see the good, choosing to look for the good, right? Which is the first step, but it's not enough. The second step is also required, and that is recognizing, where does that good come from? Did I earn it? Did I deserve it? Am I entitled to it? Or was it gifted to me? Were there people doing things for me that I could not do for myself, or securing things for me that I could not secure for myself? Were there other, the term that we use is moral agents. So a moral agent is someone, it could be a person, doesn't have to be a person. It could be a dog, a pet, for example. It could be a supernatural being like a god, for example, or ancestor spirit in various traditions that we believe is providing us with benefits, providing us with goods, services, kindness, things we cannot easily do for ourselves. And so when we see the good, we realize it's good, we realize where it came from, then the natural response is that of gratitude, the feeling of gratefulness, and then the desire to give back the good that we have received. So both of those stemming from this initial perception of the good and where that good came from. Okay, so really, I think of gratitude as living in the position and posture of yes, saying yes to life and realizing that things might be different. This doesn't have to exist, right? I can imagine a different reality where I don't have the good. I don't have my job, my wife, my health. And so we can, and our minds do that all the time, engage in these counterfactual thoughts and beliefs. Turns out that sets the stage for gratitude if we choose those counterfactual comparisons wisely. Well, a bit more on that later. you know, the science of gratitude has really exploded. That's really accelerated in the last decade. This graph shows the number of publications. This is in peer-reviewed scientific journals, just in medical journals, just the medical literature. Not even a lot of the psychological journals are included in this analysis. But if you can see the slide, the line way to the right, there it is, 2010 to the present. There's been more peer-reviewed articles in the past decade, now it's about 11 years, than in the previous 50 years, adding all those up cumulatively, right? So this means that what we know, what we've learned about gratitude, we've learned fairly recently. The science is new, and new studies are coming out all the time. I mean, there's a mountain of research now. It's so high that no one person can scale it all. It used to be the case that a few people in the field doing gratitude science like myself could keep up on most of the developments, and we learned of it. It came across our desk, and we could, you know, read it and understand it and catalog it and classify it and so on. Now there's just so much, it's impossible to keep track, which is a good thing, right? I mean, that's how the scientific enterprise works, and that's how we make progress in a scientific discipline such as gratitude. Well, what are all these studies showing? What are they testing? What are they trying to accomplish? Well, as I mentioned earlier, my own particular interest is the connection between gratitude and happiness, or gratitude and well-being. There's a number of terms which are used more or less interchangeably. They overlap a lot. There's some differences, some nuances, but we think of things like happiness, joy, contentment, well-being, flourishing, thriving, optimal functioning, right? It's all those qualities that we most want out of life, right? And one of the basic goals and motives that people have is this good life, right? Living a life of sustainable happiness, enjoying contentment and peace and resilience and all of those things. So that was kind of my starting point, because I had done research on this topic of happiness back in graduate school. I just kind of figured, well, let's take a look at the link with gratefulness. After all, it should be the case that, you know, practicing gratitude because you're noticing the good and living in that good and spreading the good when you express gratitude seems like that should impact your happiness, right? I would think so. So that became my focus, right? Is gratitude the key to unlocking and unleashing the power of happiness? Now, how would you test this out? You might say, how would you actually study that as a scientific experiment or a test? And actually, I went several levels ahead of where you would normally start the research. Normally, you wouldn't start with a randomized controlled trial, you know, and if you know anything about medical research or scientific research, particularly in the area of medicine, the gold standard for proof is a randomized controlled trial, right? Typically, though, you'd start with more of a survey, more of a correlational study, a retrospective study, that kind of thing. And then gradually you'd work your way up to doing a true intervention, a true experiment. I said, let's just go right to the experiment, right? Why waste time? Let's get in there and let's do this right from the start, to put some points on the board early, to use a sports analogy. And fortunately, things worked out the way I hoped it would. We randomly assigned participants to different experimental conditions, one of which was a gratitude condition, where we just asked them to keep a gratitude journal, and some of you may do this already, where you write down things in your life that you're grateful or thankful for. So maybe I ask you tonight, you know, before you go to sleep, pull out your journal and write down 3, 4, or 5 things that went right during the day, that went well, things that you're grateful for, and just write those down. And come back and do that tomorrow, do that the next night, and do it every night for a week, maybe 2 weeks, 3 weeks, so varying periods of time. The idea being that over time, if you reflect on what you're grateful for, that should shift your mindset, right? You should start to notice more of the good, you should start to take in more of the good, and eventually that should spill over into other aspects of your life, especially compared if you're doing something else, like focusing on what is going wrong on a regular basis. So we have comparison groups. Being a true experiment, we ask people to keep a record of their complaints, their annoyances, their hassles, their irritations. You know, for a lot of people, it's kind of like business as usual. Turned out no one had any trouble coming up with 3, 4, or 5 things that were hassling them. But fortunately, the same held for gratitude. People could easily and freely list things they were grateful for, whether it was the kindness of other people, just noticing that it was a nice day. For example, help of other people, things like just being grateful to be alive, being grateful that the situation is not worse than it actually is. Some people are grateful that nothing bad is happening, the absence of a bad as opposed to the presence of a good. There's a tremendous range of things, gratitudes that people were mentioning in these studies. Well over 8,000 people have been in these studies. We did like the first true randomized controlled trial. Now these studies have been extended and replicated all over the world in different laboratories, and people have been in these between the ages of 8 to over 80, right? So from young to older, and that's a great thing, because one thing we've learned is that gratitude is available to everyone. Gratitude is available to everyone. You're never too young, too old. It's never too early or too late to start gratitude. You're never too sick or too healthy to practice it. You're never too rich, too poor. Any of these differences doesn't matter. Gratitude is a great equalizer. It's a great leveler when it comes to opportunities and abilities to experience happiness, contentment, joy, well-being, and all of those various things. So instructions might be something like this. Write down things that happened today, or things that you are just noticing that you are grateful or thankful for. So if I did this at the end of the night, I would say, I'm so grateful I got a chance to, give this webinar to HFA, right? This is a beautiful thing that I've been looking forward to, a chance to express what I've learned about gratitude, maybe hopefully provide some information and inspiration and in some, modest way. And this would appear on my list for today. And a bunch of other things as well. So you do this and you do this on a regular basis, right? You get the idea. There's lots of ways to inculcate or encourage gratitude or practice of gratitude. This is just one. This has just become the most common way in which it's done in these laboratory randomized controlled trials. Okay. Now, let's go to this one. There's a lot of information on here. I realize that it's a very busy slide, but it's a really good way of summarizing a variety of different research programs on the benefits and correlates of gratitude. Now, if you notice, if you look very carefully at these 6 different panels, some are talking about grateful people, some are talking about gratefulness. Gratefulness or gratitude really is measured by these experimental studies. We're actually trying to activate and turn up the volume on gratitude by having people engage in these reflective exercises. But we can also examine gratitude from the perspective of a personality trait or an attitude. So we've developed questionnaires to do that. And we have a gratitude measure called the GQ6, Gratitude Questionnaire 6, which we used in a lot of studies. A lot of people have used it. It's been translated into many languages around the world. So some of the findings on the benefits of gratitude have been with this measure, this trait measure. Others have been in these experimental trials. Okay. Basically what we find are massive advantages for gratitude. For grateful people, for when people are practicing gratitude, they reap advantages across different spheres of functioning: emotional, psychological, relational, social, and physical. So from increasing emotional well-being to things like happiness and joy, for example, to getting along better with others, relational well-being factors, to actually helping people out. So grateful people actually become more helpful and giving and forgiving and compassionate and generous and kind. They pay it forward. They receive the good and they want to give back the good they've received. This is the link between receiving and giving back. And it seems to be this natural dynamic with gratitude. And then the bottom 2 panels, if you could see that, look at mental distress like depression. And many, many studies have now found that grateful people have fewer episodes of depression. They recover more quickly when they are depressed. Gratitude seems to be very, very preventive. It serves a preventive role when it comes to episodes of depression. And I mean, that's huge, given all the treatments for depression, given that depression is comorbid with so many other conditions. In fact, gratitude interventions have been shown to be quite effective with at least mild and sometimes even moderate forms of depression. And then gratitude enhances people's ability to cope. So grateful people are more resilient to trauma. Trauma being the big stress of life, so big tragedies and adversities and of various sorts, losses, those kinds of things. But even the slow drip of everyday stress, so even the minor hassles and irritations, guess what? Grateful people handle those better as well. So the big and the small, you see an advantage. And so pretty much across the board, it runs the gamut. Grateful people show massive advantages. It's linked to all sorts of better life outcomes. You really can't overplay the hand of gratitude. That's what the science has demonstrated. No studies have found negative effects or harmful effects. There's no bad side effects of practicing gratitude. And that, I mean, that's good news in and of itself, quite apart from all the positive benefits. So this is where I like to summarize as an interim summary and say, hey, 23 years of research, I can summarize that in 2 words: gratitude works. And then the tagline that goes along with that is that gratitude has the power to heal, to energize, and to change lives. And again, we're learning more and more each day, and various ways in which gratitude works, in which gratitude does in fact heal, energize, and change lives. And some of that is within the domain of the physical benefits, the health benefits. Gratitude is good medicine, as the studies show. And I speak a lot to medical audiences, to healthcare systems, hospitals, doctors, nurses, you name it, patients, chronic diseases. And there's a tremendous interest in the role that gratitude plays in healing, in health, and in recovery from illness, and making it less likely that illnesses will occur, in taking better care of one's health, engaging in health promotive behaviors, and engaging in fewer health damaging behaviors. And the links are there. Some of the links are with what we call soft outcomes, like reports of pain or going to the doctor, for example. And some of it is actually with harder outcomes, with biological endpoints, clinically verifiable outcomes, like inflammatory biomarkers. So inflammation, lower in heart failure patients, lower levels of diastolic blood pressure, lower levels of cortisol, which is the primary stress hormone, increases in exercise, self-reported exercise. And I mean, these are massive effects. When you compare them, these are equal to other traditional factors. Smoking, for example, 38% reduced rate of smoking. When people are grateful or keeping gratitude, they start taking better care of their health. You know, I mean, some of these are really eye-popping, jaw-dropping findings when you think about it. 15 to 18% better sleep. I don't know about you, but I never get enough sleep. And I often wake up the next day not feeling as refreshed as I should. Well, guess what? Gratitude affects the efficiency of sleep, and you feel better. You wake up more refreshed. You actually go to sleep quicker. When you keep in gratitude journal, you're less bothered the next day by daytime sleep dysfunction. And so gratitude is beneficial that way. On so many different outcomes, gratitude is good medicine. There is a medicinal power to grateful living, to gratefulness. So you can see why doctors, physicians, healthcare systems would be interested in these sorts of findings. Why wouldn't you want every single patient to know these things? Why wouldn't you want every single provider to know these as well? Especially because these are easily accessible. These don't require any special training, any special, going to a seminar, watching a webinar. Those obviously can be very useful. Reading a special book or workshop. I mean, we all have the power within us to develop more gratefulness. It's a choice, and I will move toward that conclusion a bit later, that we can all make and need to make on a regular basis to experience the benefits of grateful living. Okay, are you convinced yet? Well, we got more. This is not doctor. He wasn't a physician. This was a spiritual healer, care of the soul. John Henry Jowett was. I think he was a Presbyterian minister, preacher, pastor in the middle of the 19th century. And I like this. He said, gratitude is a vaccine, an antitoxin, and an antiseptic. Really, I think just summarizing. So he would not have been surprised by now the modern scientific research, which in many ways is ratifying this wisdom from the past, whether it's from the philosophers from, centuries ago, or spiritual writings from, millennia ago. They all converge on the notion that gratitude is good for us. Gratitude is good as a personal good, but also as a societal good as well. It improves relationships. And well, let's look at that next. Oh, here's one study. So if it's good for patients, might it be good for providers as well? A number of studies now have looked at this and found that gratitude practice, such as journaling, actually benefits physicians and nurses and healthcare providers of various sorts and different occupations. This was a study about 5 or 6 years ago, found that when healthcare providers were provided an opportunity to write down things for which they were grateful, they experienced a reduction in perceived stress levels and depression and perceived burnout. I mean, how important is that, given high levels of stress, depression, burnout in healthcare providers? even long before the pandemic came along. Now the need is even greater for finding ways to reduce stress and anxiety and depression and burnout. And so gratitude has been shown to be very, very effective in doing so. So not surprisingly, healthcare systems are totally behind this and want to know more ways in which they can incorporate this into their business practice, into the model. This was a quote from the article. Summary implications: positive effects can lead to an improvement in both productivity and quality of patient services, something that, of course, we all want. And I should just say parenthetically, again, that lots of other businesses, workplace, besides healthcare, have been quite interested in incorporating and building into their workplace system and setting and culture practices of gratitude, because they know that it matters. They know that it matters for business, that it's good business practice, but it's also just the right thing to do in terms of, improving the quality of the climate of the organization. And you can look at any of the traditional workplace outcomes like absenteeism or productivity or turnover rates, and you can find a substantial effect size for the practice of gratitude. And that's the case for any of these outcomes we looked at, whether they're emotional, relational, physical, workplace productivity, the list goes on. We're talking about measurable, quantifiable, and sustainable changes over time, not just temporary, not just you do something today, you feel better tomorrow, and that's it. But we're talking about changes which persist and endure over time. So you can see why a lot of people are excited about the science and the practice of gratitude, taking the findings from the science and then implementing them in their own particular settings. Awesome stuff. And it's just so exciting for me I think of myself as more of a basic researcher. Just when I get calls from different groups and organizations, they want to know about the science of gratitude and how they can, draw upon it for beneficial outcomes in their particular setting. Okay, now we get to the point where we explain, why does gratitude work? So it's got these good things to it, it seems to, right? The question becomes why? What's the mechanism by which gratitude renders its positive effects? And so I use an acronym to describe this, which I call the ARC, or the ARC model of gratitude, where A, R, and C all stand for one of the three mechanisms. The A means amplify, the R means rescue, and the C stands for connection. Okay, so the first thing gratitude does is that it amplifies the good. You know what an amplifier is, right? It turns up the sound. A speaker, it makes the sound bigger and deeper, right? The bass deeper when you have a subwoofer, right? If you are getting old like me and you need to wear reading glasses, to read the print, or maybe even a magnifying glass, that magnifies, it increases the size of the print. So this is what gratitude is doing. It's making everything bigger and bolder and brighter and better. It's turning up the volume on the good in our lives. It makes us more notice the good in our own lives, the good that we see around us, the good that we see in the world. And it's really important because our mind tends to do the opposite by nature. It tends to actually minimize the good and maximize the bad, amplifies the bad. We have this built-in negativity bias in our brain, so it causes us to look for the bad. It causes us to focus on what's going wrong, not what's going right. It tends to make bad things stronger than good things in our visual field, in our what we recall, what we notice in other people. That's why complaint seems to be so much stronger than compliment, why pain is stronger than pleasure, why dissatisfaction and disappointment is greater than success, and delight and so forth. And so we got to overcome this negativity bias. The way to do this is through a mechanism which is a counteractive force. And that would be something like gratitude. Might be others, but gratitude is one of those. Now, I like to traffic in metaphors. I've written a couple of different books, and one of them I have a chapter on the gratitude metaphors and some of my favorite ones. And this is one of those, that gratitude is fertilizer for the mind. And I don't know if you garden or put fertilizer in your lawns or whatever, but what a fertilizer does, right? And makes things grow better. Okay, it provides essential nutrients to plants. And that's the way it is with gratitude. Gratitude supplies essential nutrients to our mind, to our body, and to our spirit. It spreads connections and improves functioning in nearly every realm of experience. And it turns out this is actually more than a metaphor. It actually has been demonstrated that it describes, in many respects, what is actually going on in the brain when a person is feeling gratitude or experiencing gratitude is actually turning up the volume or amplifying the good in the brain. And so, and you probably heard of neuroplasticity. It's been quite a popular topic for some time now. The notion that we can change parts of our brain, we can grow different structures of the brain, we can improve them, we can deepen and strengthen. That experience can change brain plasticity so plasticity, neuroplasticity means that possibility for change, right? The brain's malleability is what it is. And so when our mind changes, our brain changes as well. And many, many decades ago, the first person to really talk about this and to call attention to it was the famous neuropsychologist by the name of Donald Hebb, who coined the popular phrase, still used today, that neurons that fire together wire together. And so now a more modern take on that is that the brain takes the shape that the mind rests upon, or that we can use our mind and our thoughts to sculpt the brain. And it's quite interesting, especially in the context of gratitude. So just think of that as an analogy, right? So the brain takes the shape that the mind rests upon. What flows through the mind sculpts the brain, to use the language of Dr. Rick Hansen, who is a more popular neuroscientist. He takes the neuroscience and he kind of translates that into language that the average person can understand and can benefit from. So for example, if you rest your mind upon things like worry and sadness and annoyance, your brain will start to take the shape neurally of anxiety, depression, and anger. Ask your mind to give thanks, and it will get better at finding things to be grateful for. It will begin to take the shape of gratitude. At least that's the hypothesis. Well, there's some evidence this actually might be happening. What is the shape of gratitude? What does a grateful brain look like? Well, there's about 9 or 10 studies, which are pretty good right now. We're learning more. These are fairly preliminary, and gratitude is a very hard state to actually be able to pinpoint in the brain scan, because it's such a complex social emotion, and it's there's so many layers and levels to it. It's not it's not one of the basic or primary emotions, but it does seem that different brain systems or different brain centers are involved. It seems to be rooted in multiple brain systems that involve the reward network. This is just so here's a simple view of it, which is, here's your brain reaching down and shaking hands with your heart, because it does involve both the heart and the head. It's both a feeling as well as a thought or a cognition. But a little bit more scientifically speaking, we can point to the reward network, right, which involves the medial prefrontal cortex primarily. The cognitive social perspective taking, which makes sense because after all, it is an interpersonal feeling. You have to become aware of the intentions of others, know that the other person is trying to benefit you, or you want to benefit the other person by your action. After you receive the good, you want to give back the good. So it's going to involve social relational structures in the brain as well. And then it's been also suggested that the empathy for pain centers as well are going to be involved in that, because when we are aware of the intentions of someone else, we realize they did something for us that involves some cost to them. They went out of their way in terms of time or effort or money, perhaps, to help us out. And so that part of the brain also shows increased blood flow, meaning increased activity. So it's kind of interesting that some of the research now is examining the neuroscience, the neurobiology, as well as the neurochemistry of gratitude. And what the results so far are pointing to preliminarily is showing that really gratitude has a diversity, which you would expect since it is a very complex social emotion with many different layers and levels to it. The brain's ability to unite together different processes into specific situation really runs the gamut in terms of gratitude's emotional or affective territory. So that's fascinating research, and I'm trying to keep up with it. I don't really have the background in neuroscience to understand all of it, but I think that it's going to really be the next generation of research, really trying to explore the mechanisms by which gratitude is good medicine or has medicinal benefits, is going to be through some of these neurobiological pathways. Well, I mentioned the R, and let me go quickly now because it's now 40 after, and I want to leave some time for questions and answers. Gratitude rescues mental immunity. So here's a chance for you. I want to see what you're thinking about this. What would you say is the opposite of gratitude, or what gets in the way of gratitude? Why is it so hard? So here's the thing that I've always pondered, gratitude is so good. It brings all these benefits, yet, it doesn't come that easy or naturally to a lot of people, including myself. Like my default is not to be grateful. I've worked hard at it, to make it more of a default, but I just kind of naturally drift toward negativity, toward complaint. What else would you say would be the opposite of gratitude? What gets in the way of gratitude? What's an obstacle that you notice, maybe in your own life or in the lives of people around you when it comes to practicing gratitude? You just go ahead and put that in the chat, okay? A couple of things just to see what you're thinking about, obstacles to gratitude, and we'll consider that. I actually have a picture, I think, of like a big boulder. There it is, like a roadblock, right? Sometimes I think of gratitude as a wall that I run up against, I run into, when I try to be more grateful. Chronic pain, yes, chronic pain can be very infertile ground for gratitude to grow, right? Suffering and pain. You take things for so granted, right? Just taking things for granted, not noticing things. Anxiety, lack of perspective, hardships of various sorts, life experiences. Thank you. Those are all good suggestions, right? Sometimes what else? We have an expectation that things should be different than they actually are. Could that be one? We might think of that as an entitlement, right? If we believe we're entitled to good things, it's hard to be grateful for those, right? Because after all, gratitude is when you get more than you expect, or you get a gift from someone. You don't have that if you demanded it or you feel deserving of it, and the like. So those are all really good suggestions. So those are some of the obstacles, right? We have to be rescued from those, and gratitude provides us with this rescue, this what I call mental immunity. It strengthens us up so that the hijacking of our mind by negativity, by chronic anxiety or resentment or entitlement or taking things for granted is less likely to occur. And then the last one, the third one, is that gratitude connects. Gratitude really is a social emotion that it connects us together with others. The relational quality, it's in the context of relationships where gratitude or the lack thereof is most keenly felt and keenly noticed. It just strengthens and it binds people together in relationships of mutual obligation, responsibility. And lots of studies have found, I see there's lots of questions, so that's good. And we will get to those, I promise you we will, but lots of studies showing the social benefits of gratitude, boosting positive behaviors, deepening relationships, fostering kindnesses and new friendships, and all of those things. Okay. Now, all three of these aspects, amplify, rescue, and connect, are seen in people when they report what gratitude does for them. So I just have a few quotes here. These are from people with mild to moderate depression, and they're saying all these things. It helps me see the good in people. It brings me back to the present situation. It makes the negativity go away. I feel lucky for myself rather than sorry for myself. I remember that there is help, that help is on the way. I realize I can't do this all by myself, that there's people I can rely on, and so on and so forth, right? So we see evidence of all three of these elements. So you mentioned some of these things. Now, okay, here we go to the final thing that I want to talk about with you before we look at the questions, and that is, how do you get more of this? Gratitude is good, but we got these obstacles. We got to get past these obstacles to experience the benefits that grateful living offers to us. So I like to refer to this as the aware, declare, and share model of gratitude, that we can become really good at becoming grateful, even if it's not natural to us, even if it's not our default state. Maybe we got to work a little bit harder at it. But we find that when we do that and make the commitment to it and pay attention to gratitude inspiring experiences, actually we can become more grateful. We can actually become great at being grateful. And there's a variety of different activities we can do, strategies or steps, practices, I guess is a good general all-purpose term, from journaling, which is a very private, personal activity. So we can journal, we can write what we're grateful for. We can write a letter of gratitude to someone. So expressing our gratitude to them. So I like to say there's a personal, private component to it, and then there's a public, expressive component to it where we want to broadcast or distribute our gratitude. That's a very good thing. These are all beneficial, right? And so not one size fits all. We have different strategies because we are different people and different things work for us. There are all ways to deepen our awareness of gratitude. It has to be a conscious everyday decision. And so one of the reasons why I study gratitude, why I like to write about it and talk about it, is that I need to be remembered. I need to remind myself every day to practice gratitude. Because you know why? Because every day I forget. It doesn't come that easily or naturally to me. You think it would after 23 years, but you know, I'm just, you know, on a journey to become more grateful, as a lot of us are. And this helps me to be a scientist and to study gratitude. And I learn more about it, and I try to put some of these ideas into practice, realizing that it's ultimately up to me to choose to look at life through a lens of gratefulness. As did this man. This is a 49-year-old man by the name of Steve Fisk, who has a inherited neuromuscular disease. Actually has a form of ALS, or Lou Gehrig's disease. And he gets to the point where the disease has drained most of the life, most of the movement out of his body. And I think he sensed that he didn't have too much time left on this earth. And so he calls his wife and his two daughters over to his bedside, and he wants to tell them something very deep, very meaningful, very personal. And so he asks them to write this down for him. And he starts talking about his life, saying, you know, my life is not fair. And you think, oh, he's going to start complaining, right? But quite the opposite. He starts saying how it's not fair that so many things have gone right in his life, that he had so many benefits and so many, you know, privileges, basically. A warm, loving family. He had friends to do things with through the years. He said to camp and backpack with. He said, ALS is a terrible disease, but it does not negate the rest of my life. Shortly after Steve dictated these words, his family celebrated his 49th birthday with him. A month later, he died from ALS, right? But you know, so he chose gratefulness, right? And even in spite of what was going on in his life. And that's the beautiful thing about gratitude, is that it seems to work, not just when life is going well, but maybe even especially when life is going poorly. When life is going poorly, that's when gratitude seems to have its maximal benefit. One person said that for the light of gratitude and happiness to shine so brightly, the darkness of how it could be worse must be present. Gratitude is not just the light to turn on only when things go well. It's also a light that shines in the darkness. So give me 2 more minutes and I'll be done. If we choose to see the world through grateful eyes, as Steve Fisk did, and so many people do that contact me on a regular basis, and I hear from a lot of people who have testimonies about how they've been through some of the most horrifying things in life, you know, addictions and abuse and loss and cancer and grieving and, you know, you name it, one trial and tribulation after another one. And they say, you know, I made it through the dark side, the dark night of my life. I made it out of this hole that was so deep, I had to reach up just to touch the bottom. It was gratitude which got me through it. It was gratitude which shined a light on this darkness. They chose to see the world through grateful eyes. They started to see possibilities and opportunities when they just saw problems and adversities before. They started to take things as granted as opposed to for granted. They started to see positivity instead of negativity. It's like this total switch came into their lives. They were transformed by the possibility and potential of gratitude. So this is the point where I often recommend some books to read to go deeper than I can go in 40 minutes of a presentation. And I often recommend my own books, but in this case, I'm going to recommend 2 other books written by 2 other people, both friends of mine and sometimes colleagues of mine as well. The first one on the left is about gratitude. The one on the right is about joy. Actually, Christy Nelson, and these are both people who have been through the crucible of suffering. And I won't get into all the details. You can read their books and read their stories, but one had cancer, and that was Christy, had stage 4 cancer, survived that, recovered from that, and her gratitude grew as a function of cancer. So it wasn't that gratitude was just this way around or out of cancer where she ignored the pain and the negativity and the suffering, but really it was a result of going through in her trials and what she experienced. And she tells her story in the book called Wake Up Grateful. It's a wonderful book of exercises, affirmations, meditations, inspiration, and so on. So you can bring more the practice of gratitude into your life. And then Angela Gurrell, she's a professor of practical theology at Baylor University, wrote a book. It's coming out in 2 weeks, March 9th. It's called The Gravity of Joy. And she was hired at Yale University, where she was at before she moved to Baylor, to study joy, to study like, what makes life most worth living, what makes life enjoyable. And guess what happened? Shortly after she was hired to work on the study of joy, three terrible things happened to her. Her father died of a fatal opioid addiction. A close family member died by suicide, and her nephew, 22 years old, died of a sudden heart attack, sudden cardiac arrest. She was supposed to study joy, and she said, my vocation was supposed to be joy, and I was speaking at funerals, right? And this was just 5 years ago. And so she tells her story in this book, The Gravity of Joy. And much like Christy Nelson's book, it was about how joy and gratitude are made stronger through suffering, through adversity. It really was. Both of these books are very inspiring. And it just, to me, points out that gratitude is much more than just positive thinking or happy thinking. Really, it is taking suffering on head on, right? And seeing that there is opportunities, there are possibilities. That it's a way of seeing which changes our view, it alters our gaze. And that really, I think, is the message of gratitude and grateful living. So many different ways to say thank you in a lot of different languages. I thank you so much. There is my email contact. And now, at last, we can go to the questions. I'll stop this share of the slideshow and see. So, Anne, how should we do the questions? I don't see them in the chat, but I think they're in. There's a Q&A, which is separate, okay?
Yeah. Can you see the Q&A?
I do. Let me try to answer as many as I can, all right?
Sure.
So Sharon Myers asks a wonderful question. Is it possible to help others be more grateful? And yeah, I mean, that's one of the reasons why I do this too. And this is a great question, which is often asked, but in a slightly different way, a different context, it's kind of funny in a way. That question which will often come will be, how can I get so-and-so to become more grateful? And so Sharon, you framed it, I think, much more diplomatically. But a lot of times people will say, well, how can I get, my kids, my teenagers, my husband, my boss, whoever, coworkers to become more grateful? And I think, the best way to do it is just to be a good role model for gratitude, especially, I'm sure the context in which you're getting at here, but, it depends because relationships are all different. But it's hard to it's hard to teach someone something that we ourselves don't have. And we can give others the gift of gratitude just by being good role models, by expressing gratitude, by giving them opportunities to express gratitude, to be good receivers. When someone wants to say thank you, a lot of us are very bad receivers of gratitude. And we say things like, hey, no problem, don't mention it, it's not a problem, no big deal. And that's very dismissive when people want to be grateful and want to express that gratitude. And that one of the best gifts we can give people is just accepting, taking in that gratitude, giving them the opportunity to receive that gratitude, because it's a very strong need, I'm convinced, that people have to express thanks. And you're providing them with that opportunity to do so just by, just by saying, well, you're welcome. Okay, or that's so nice of you, thank you. We could receive the gratitude I think in a much more positive and affirming way and not be so dismissive of it. So those are just some suggestions, and it all depends too on the nature of the relationship. I know I've worked with parents, and there's a lot of psychologists who are interested in the developmental aspects of gratitude and what are the best ways to socialize children for gratitude. And that really depends upon the age of the children. But, children are very visually focused. And so various practices surrounding gratitude, which are very practical, very object related. So people can draw pictures of what they're grateful for. They can have gratitude walls on their homes. We can have gratitude walls at our workplaces. I know how a lot of hospitals have that, where patients or co-workers can write down who they're grateful for and what they're grateful for to that person. So visual images are very good ways to become grateful, and we can share that with others as well. So that's just a few ideas about that. Hard to be grateful these days. Well, it is. How do you get past all the hard stuff to have gratitude? I think the key is really expressed in people in those lives like Christy and like Angela, who have written about that, who have been through the hard stuff, who say, if it wasn't for that hard stuff, I don't know if I'd be grateful or have joy, because in the context of experiencing those negative states, that allowed the joy and the gratitude to come to the surface. And it turns out there's a lot of research which actually ratifies that. We ask people to remember the hard stuff in life, the bad stuff, and that actually makes them more grateful, because one of the things it does is that it makes us more dependent upon others. It just kind of shatters our illusions of self reliance, and that we can do it all by ourselves. And so that forces us to become more aware of how others are helping us out. So again, this notion of a choice, it doesn't mean ignoring the bad or ignoring the harmful or the painful things, but it's just seeing the opportunity. There's always an opportunity that exists or that lurks, and maybe not immediately. Maybe it's going to be, a month from now or 6 months or a year from now. And there's ways to transform those tragedies into and that's what the grateful people do. They find ways to extract something beneficial from even, the hardest things they've ever been through. And so that is a skill, though. I mean, it's a skill, I think, which has to be practiced, right? It can become a strength. And when this strength is practiced, it becomes a tool in our toolbox, our toolkit for, again, I was saying that there really is no resiliency without gratitude. There is no contentment, no joy without gratitude, because it just provides a new way of looking at life. It embeds in us a new way of seeing, and embeds us in a new way of seeing, which I think can be very, very beneficial. Gratitude helps with worrying, for sure, Sharon. Gratitude, we know, as a positive emotion, tends to drive out the negative ones. And you cannot be grateful and be anxious at the same time. They really are incompatible. When you're grateful, there's a sense of peace. There's a sense of security. When you make a list of things you're grateful for, when you wake up in the morning and say, okay, today I am grateful for, or today is a gift because of, or today I get to do X, Y, Z, as opposed to I have to do X, Y, Z. There's so many ways in which we can use self-dialogue. We can use language to change our perceptions, to look at life through this lens of gift and giftedness and gratefulness. And that's a beautiful way to be, because that really is a very high level of gratitude. Gratitude exists on a plane ranging from a habit of just saying thank you to really a deep and abiding way of living in the reality that life is a gift, that life is full of gifts. And if we can move in that direction, eventually we'll see that'll start to crowd out things like worry and anxiety and fear, because gratitude becomes an antidote to a lot of these negative states. It doesn't mean you'll never experience them. And again, those are also, of course, very important to experience, because those are providing us with information that is critical to living life fully. But we don't want to be overwhelmed by those. We don't be paralyzed by those. Gratitude can help us get those under control. And I think that's the key to remembering. Okay, trauma, right? Recent trauma. So let me go on to this one about having hemophilia. You're right. I mean, there is a difference between being grateful for something and then being grateful despite something, right? Nobody's grateful to have a disease, right? That'd be very rare. To say that I'm grateful that there was a pandemic, or that, I lost my job, or that, my family lost their business because of the shutdown. We're not grateful. We're not grateful for poverty. We're not grateful for illness. But can we be grateful despite those, right? Can there be something that we can find that maybe can something good come out of something bad? Can something good come out of illness or disease or divorce or disappointment, or any of those things? When a relationship ends or when a job ends, can anything good come out of those things? Well, we know all the time that things do often come out of the good. Out of the bad. We can have a redemptive twist from the bad to the good. So yeah, but no, I'm not going to be grateful for that bad stuff. I'll be grateful in spite of that. I'm going to call this defiant gratitude. It says that I'm going to choose the attitude of gratefulness, not because something is happening, but in spite of that. And so I think it's really important to distinguish between gratefulness, which is an orientation toward life, and gratitude, which is conditioned on specific thing happening. Gratitude is as conditional, means that you're only going to have it when a good thing happens. You can't have it when the bad thing happens. But gratefulness is a much deeper sense that I'm going to trust in life. I'm going to trust that ultimately something good can come out of something bad, and that's a much deeper and I think a much mature level of gratefulness. And that's how we can experience it, just even in the face of suffering. So. Sounds easy. You say, Professor, that's wonderful. That sounds great, right? But yet we know that people go through this all the time, and they come out on the other end. And not just those two individuals I mentioned, but again, people that contact me. 18-year-old girl writes and says, I was addicted to drugs. I was suicidal, and I found help on an app on my phone to practice gratitude. And she writes to me and says, I want to become a psychologist and help other people to do the same thing, turn their lives around, right? Because she turned her life around, and it was through the healing power of gratefulness. Gratefulness becomes people's spiritual lifeline. And that's what inspires me to keep studying this and keep talking about it, keep writing about it, and giving talks like this and sharing with audiences what I've learned, because it's very humbling to hear these sorts of stories and to be able to share those with you. What else? Any other question? And we're at 5 o'clock, but I'm happy to keep going as long as people are still signed on.
They are still signed on.
Okay.
There are a few more questions there.
Yeah, absolutely. So anonymous attendee says, a friend recently told me that her boss begins each day with, I mean, the practical ways that you can carry this on in organizations, has all sorts of ripple effects, right? Whether it's from the, the bottom up or the top down, organizations begin their meetings, just start a meeting with a moment of appreciation or gratitude, or businesses learn that having formal recognition programs, social recognition programs, is so beneficial. Where their employees get recognized through various, channels throughout the organization. And I've talked to lots of organizations like this where they really make a point of that. It really becomes part of their culture, part of their identity. They become a gratitude-driven organization. And there's lots of ways to do that, and through notes, through these, gratitude boards, where it just becomes much more apparent, and a real visual aid that helps remind us, because we tend to be very forgetful people, right? So we need the reminders, we need the affirmation, the validity that comes from just people noticing us and just appreciating them. And that's why I think that broadcasting gratitude, that distributing gratitude, is so important. If we keep it all inside and personal and keep our journals going and work on our own gratefulness, sure, that's fine, that's good. It's better than working on being ungrateful. But I don't think it's going to have the maximal benefit until it's expressed and distributed and broadcasted publicly. Then we start to see the ripple effects. We start to see it spread through organizations. Like when you see one person express gratitude to another person, that's powerful. And there's recent studies showing that person C, who watches person B express gratitude to person A, then wants to do something nice for both of those people, both B and A. And that, that gets magnified over and over again. And that can, create lots and lots of positive upward spirals within an organization. So the boss is smart, right? Who writes the thank you notes each day, quite even if they didn't share them. And hopefully they do share those thank you notes, because then it has a much greater impact on the receiver as well as on the giver. So thank you for that. Glass half empty. So Tracy asked a very good question. Yeah, I mean, there is biology, there is temperament. And some people by nature tend to be more pessimistic, and some tend to be more optimistic. And I have to tell you, it does take a little extra work. And I mentioned that with respect to myself. I was always someone who kind of took things for granted. I was always looking for something beyond what I had, something bigger or better or brighter. It was always the next job, or the next, grant, or the next publication, or whatever, right? And I had to realize that no, sufficiency was enough. I had everything I needed right then and there to be completely, totally, sufficiently happy. But that was a lesson that I had to learn. And if one tends to be more anxious or more pessimistic by nature, you got to work a little bit harder at it. But the science shows that those people actually have the biggest gains. They have the most benefit from the practicing gratitude. Why? Because, they have the most ground to cover, right? They have the most possibility for improvement. So gratitude experiments and gratitude inductions actually work better with people who maybe are not on the +7, +8 side of happiness. Maybe they're on the -2, -3s, and so they can work their way up. And this can become a habit, but you may need to work on it a little bit more. It may need to be more of an intentional practice before it becomes the default. And of course, that's the goal, right? To make this the default way of looking at life. And, you're trying to replace a system and a structure and a way of looking at life that, has worked for you for maybe decades. And it's not easy to change. People don't change very much or very quickly. But gratitude is in fact one of those things which can measurably change people's lives. So thanks for that question.
That was the last of the questions. I think you covered some of the others. Unless someone else has something right now, it's probably a good point to wrap things up. And I'll leave it to you if you have some few last words, and then I'll take care of some business.
I mean, I think gratitude really, there's so many ways we can respond to life, right? And we can react to stuff happening, or we can have more of a responsive mode. Dr. Hansen, who I mentioned, is this neuropsychologist. He said we have a green brain and a red brain, and the red brain is reactive. The green brain is responsive, and we want to have more of a responsive mode. And the responsive mode is that where we can respond with gratefulness, right? With seeing things as a gift, not necessarily things that are going to make us feel happy or we're glad that are happening, but it just increases the range of responses we can have in a situation. It gives us more flexibility. And I think that's the key, just realizing that we have the choice to respond to events and situations that we can't change a lot of the time. But we have, as Viktor Frankl said, the famous, World War II concentration camp survivor, he said, the only thing we have control over is our mind to give the meaning to the situation, to our life circumstance. And one way to give it meaning is through the lens of gratefulness. So I invite everyone to try out gratitude, to practice it. And some of you already do that, and you know more about it than I do, and are expert at it already. Others, it's more of a new way of life, a new way of looking at life, but people report it actually does bring a new lease to their lives. So I really appreciate your staying, it's 8 o'clock where you guys are, a lot of you, and staying on and listening. And gratitude is the best thing that's happened to me. Personally, my life is far better than I could have ever imagined or envisioned. And that's why I study gratitude. It's nice that I can make a living at it. That's a benefit too. But I just really try to experience on a daily, regular level. And it's made my life so much better. And I invite you to practice gratitude as well.
Thank you so much, Dr. Emmons, for being with us this evening and sharing your research, your insight, and helping us to have a new perspective on life. Thanks to all of you for joining us this evening. Please remember there will be, the recording will be available on the HFA YouTube later this week. And please watch for more mental health and well-being webinars and resources available at the HFA website, on our social media channels, and through our regular email communications. So good evening to everyone. Thank you again for joining us. Please take care of yourself and others. And good night, everyone.